Welcome back to DBL. We've got our one and only Dr. Coley joining us. Thank you so much for being here. We want to talk about a good friend of the show. She is a wonderful human being and a good friend. Former Dancing with the Stars host Samantha Harris. Last week, she revealed that she was diagnosed with breast cancer for a second time. Take a look at this.
I have some health news that I need to share that I never thought that I would be sharing again in my lifetime, but I have a recurrence of breast cancer. And I feel so fortunate to have been able to guide, support, and lead so many of you in the Your Healthiest Healthy community, and I will continue to do so, and I will fight on, and I will be okay.
If anyone I know will be okay, she will be okay. How common is it to get a reoccurrence of breast cancer, Doc?
I mean, she's putting such a positive spin on it, but it's so tragic because she first got diagnosed when she was only 40. And it really depends on kind of the stage of diagnosis, the type of cancer, whether it's hormone receptor positive. So hers was stage 2, which means that when she was diagnosed at age 40, it had already spread to her lymph nodes. And in situations where the cancer has already spread to the lymph nodes, there's about a 25% chance of recurrence. Now, you can make that better by getting a mastectomy, getting radiation. I don't know if she got radiation. I know she got a mastectomy.
She did, yeah.
Yeah, so that kind of helps maximize your chances. But when it comes back, it's really a sign that some of those microscopic cells were left behind.
Oh.
So, Dr. Coley, when you were just saying, obviously, Samantha got breast cancer the first time in 2014, and she did have the double mastectomy, right? So how can you get breast cancer again if you've already taken that step? Is it because it went into the lymph nodes?
Yeah. So a lot of people think, okay, I got the breast removed, that means I can't get breast cancer. But if you think about it, there's some breast tissue left behind at the chest wall and at the skin, right under where it was removed. Then the lymph nodes, her cancer had spread to the lymph nodes, so it could have what's called a regional recurrence, which means it recurred in the lymph nodes, or you could have what's called a distant recurrence, means that it's already spread to another part of the body, like her liver, her brain, or her bones, or somewhere else, and it might have recurred there. So it's really unfortunate, despite the mastectomy, that she had this recurrence.
I hate cancer. I hate cancer.
It's so strange. I was listening to a podcast on Friday, it was strangely about cancer, and they said even when they say they go in and got it, they usually mean they got about 97% of it.
Well, we can't see cancer always. I mean, we can see the tumor, so we try to get negative margins, but we can't see the microscopic cells. And that's where we're really trying to push the frontier of science forward. Because what if we could, once we take out your cancer, make a little breast cancer vaccine, which is what I'm really excited about, which means teach your immune system how to look for the cancer so that if these little microscopic cells come back, your immune system, which can see better than our eyes can see, will find it and fight it. So that's what I would hope for women who have, especially high-risk breast cancer, get these breast cancer vaccines. They're in clinical trials right now. They've not been approved. But I'm really hopeful for the future with these.
Well, Doc, a lot of people are watching this show, and they are, luckily, thankfully, breast cancer survivors. So what is the best way for them and anybody that may encounter this to monitor, to make sure that they don't get breast cancer a second time?
You know, you got to take control. You have to be in charge, and you can't rely on the system to tell you what to do. We don't have a blood test for breast cancer. The only tests we have are imaging tests. So you can't get lazy about it and say, oh, they got the whole cancer, it's taken out. You got to make sure you stay on top of mammograms if you still need those. MRIs sometimes are a more sensitive way to look at the breast tissue because they zoom in closer. Or, of course, if you've had metastatic breast cancer beyond the breast, sometimes they'll do CT scans. So imaging tests really help us to know, but make sure you get them regularly like your doctor tells you to.
All right.
All right, Doc. So another star, Danielle Fishel from Boy Meets World, just announced she has breast cancer. She said she was diagnosed with DCIS. So what is that, first of all, and how is that treated?
Yeah, I used to watch Boy Meets World.
Topanga!
Didn't you?
Of course.
All the time. And I liked Topanga because she was a little odd and unfortunate, again, to hear this. But DCIS is a much better prognosis. It's called ductal carcinoma in situ. Ductal means it's in the milk ducts. Carcinoma means it's cancer. But in situ means that it hasn't invaded yet. And so that means it's just microscopic cancer cells. And what's tricky about this cancer, guys, is that it doesn't present with a lump or any symptoms. So it's just usually calcification seen on a mammogram or some other abnormality seen on MRI, which tells the doctor that you have breast cancer before you even know it, because you don't actually feel anything because there's little microscopic cells. So it's the best breast cancer to have because it's in situ. But depending on how much DCIS you have, if it's just in one spot or multiple spots, they may still recommend surgery. They may recommend mastectomy. They might actually recommend potentially radiation and hormone therapy as well. If it's got hormone receptors on it, then sometimes they'll give tamoxifen or other medications like that to sort of turn off the hormone receptors on the cancer.
Wow. All right, well, we're wishing her well. Let's talk about another cancer, ovarian cancer. How many of you are related and relatable to this? Because it's a very, very difficult to detect. And a new study says there are 4 symptoms we should be on the lookout for. They are bloating, abdominal pain, needing to pee frequently, and feeling full quickly. I've talked to you about personal things here, and I'm concerned. What are some thoughts on these symptoms and the best way women can be on the lookout? Because I was like, what if I feel like I might have some of those symptoms? What's my next step?
Listen to your body. Because the problem with ovarian cancer, we don't do population screening because it's not effective. So we don't say go get screened for ovarian cancer. Right. So the symptoms really clue us into who we should be screening, and that's what this new study looked at. These 4 symptoms in particular that you just listed, Tori, if you have those and you get fast-tracked to get a blood test, because there's a type of ovarian cancer that releases a blood biomarker, it's called CA-125, or to get an ultrasound, a vaginal ultrasound where they look at the ovaries themselves. So they got these women in within 2 weeks. Whereas the current guidelines in countries like Australia say you have to have symptoms for a month before we'll even look. But, you know, with ovarian cancer, time is everything, early detection. And you don't want to keep waiting, because if that tumor spreads, just like with other cancers, it's almost too late. So at the earliest sign of symptoms, even if it's only one symptom, talk to your doctor and see if it makes sense to get checked out with blood tests and ultrasounds.
Okay, well, I'm feeling some of those symptoms, so I'm being really honest here. I'm going to go get that checked out with Dr. Coley. Please. I want to do it quickly, and I think if anyone out there wants to write me and says I'm scared and wants to do it too, let's do it together. Thank you for joining us again, Dr. Coley. DBL Nation, follow Dr. Coley on social media at Pile Coley MD. You can also subscribe to her YouTube page. Plus, check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thank you again, Doc. Coming up on DBL, Jessica Alba.